Uganda had a problem of AIDS, and in our own view, we could not handle the problem alone. We required the support of the international community.
I am among the 53 million people who have been infected by the deadly disease HIV/AIDS, a product of the silence that surrounds issues of sex, sexuality, and sexual health.
Ate era bwe navaayo nga bamaze okufuna results nga bamaze okunkobera nti namala okufuna akawuka.
People laughed at me and I thought about dying because I had not yet accepted that I was HIV positive.
Kyantwalira omwaka mulamba okukobera.
I could not tell my wife when I found out I was HIV positive because I was afraid she would leave me. It took a whole year to finally tell her.
In the early 1990s, there were more people infected with HIV in Uganda than in any other country in the world. HIV/AIDS was spreading throughout the country like a bushfire. But by the year 2000, HIV infection in Uganda had fallen by at least 1/3, more than any other country in Africa. How was Uganda, one of the world's poorest countries, able to achieve this? The answers are not simple. Many different individuals, groups, and organizations have implemented effective strategies in Uganda's national response to the HIV pandemic. But the underlying factor in all these efforts is openness.
In the beginning, whenever someone fell sick, they would hide in their houses. The patients did not want people to know that they were sick. Even their relatives would not allow other people to see them. They were keeping it a secret because people mistreated the patients since they didn't know how the sickness spread.
It was here in this fishing village on the western shores of Lake Victoria where AIDS was first identified in Uganda in the early 1980s. Very little was known about AIDS, and it was shrouded in secrecy, ignorance, and stigma. As in other countries around the world, many Ugandans responded initially by denying the reality of AIDS and then by stigmatizing those believed to have the disease. In 1986, the National Resistance Movement government came into power. They quickly realized that AIDS was about to explode into a major public health problem. Rather than deny it, as the previous government had, they decided to tackle the problem head-on. In May of 1986, they made a shocking yet necessary announcement.
As Minister of Health of the new government of the National Resistance Movement, I went for the meeting in Geneva, World Health Assembly, and I announced to all gathered that Uganda had a problem of AIDS, and that in our own view, we could not handle the problem alone. We required the support of the international community. I'm glad to say that the international community responded positively. And I must say that the whole government got mobilized, and the president of the country became not only the commander-in-chief of the armed forces, but he became the commander-in-chief of the forces against AIDS. And he and his government used every opportunity to sensitize the population.
This, therefore, leaves one root. This is the root of sex, unorganized sex, like the sex of cows or goats. All the cows are wives of any bull which comes. And also the bulls are husband of any cow that is around. Now, that's what I mean by unorganized sex. This is the one which causes AIDS. Because somebody has got AIDS, he spreads it among so many people. And they also spread it among other people. That's how AIDS is spreading.
As part of this sensitization, the government undertook an aggressive media campaign. Using posters, billboards, television, radio, and newspapers, the country was presented with information aimed at presenting facts about HIV and AIDS. and reducing the denial and stigma surrounding the epidemic. Although some thought it too aggressive, it proved to be just what was needed.
I think we must have made some mistakes. Some of the initial posters that we put up caused some concern. Others thought we were being very immoral by talking about sexual issues in such an open way. But quickly, the country realized the gravity of the problem and hence got mobilized and came along in the campaign against this problem.
The new government's commitment to openness about HIV and AIDS led to the establishment of the AIDS Control Program and later, the Uganda AIDS Commission. With the government's commitment and openness clearly stated, it wasn't long before the people of Uganda would take up the challenge in their own ways. One of the earliest and most influential of the community responses was the AIDS support organization TASO, established in 1987 in Kampala with support from Action Aid. Among its initial 16 volunteers were 12 people with HIV/AIDS. TASO provided many services including counseling, nursing and medical care, material and social support. But it was their attitude towards those infected that had the greatest impact. TASO's unique contribution towards openness about HIV/AIDS at that time was the concept of living positively with AIDS. This approach provided an antidote to the fear, denial, and stigma that surrounded the epidemic. Through volunteers who were HIV positive, TASO demonstrated that infected people could still make a meaningful contribution to society. Their willingness to share with others openly about their HIV status helped many people realize that the attitudes and fears they held towards people with HIV/AIDS were incorrect and unfounded. TASO also provided training and support for a number of other organizations, including the AIDS Information Center, which provided voluntary counseling and testing to people who wanted to know their HIV status. AIDS wasn't only a problem in Kampala. At the same time TASO was beginning its work there, various initiatives began in other parts of the country. In the districts of Masaka and Rakai, where AIDS was first identified in Uganda, Kitovu Catholic Hospital was treating a lot of AIDS patients. The community-based healthcare team that worked out of the hospital found that many of the community members were HIV positive, but were not being cared for at home. They developed a mobile home care program to meet people in their homes. But the stigma and fear were still quite high and affected the care the program was able to provide.
It was very difficult in the beginning. Even when they saw our car coming, people said, that person has AIDS. So the people that came for treatment in the beginning were very courageous.
At first, the people, the patients themselves were really dying in a terrible way. But when they received the treatment, they knew there was hope because the treatment helped them a lot together with the counseling, because these go hand in hand, of course. It helped them a lot that they regained confidence in themselves and thought that they could live longer. For all those who are dying were, of course, dying in with the dignity, of course, and that being one of our objectives in the home care, to help these people with this counseling and symptomatic treatment so that they die with dignity. And when the people, the community itself realized this, that the people had regained the health and were really dying with dignity, then they came in. So as the program to extend its services even to other areas.
The mobile program staff works with community volunteers to provide medical treatment, pastoral care, health education, and counseling. When the clients gather, they first discuss health education with the volunteer on topics ranging from TB, diet, and hygiene, to making out a will and who will care for their children after they die. It is practical discussions like these, led by the volunteers, that have helped the communities open up.
I think a lot of it is to do with staff and with our volunteers. over the years, our volunteers come from the communities. We have given them a lot of training, particularly in counselling. And they go back into their communities and they're available to the people. When somebody has AIDS or they're worried or they want to be HIV tested, they go to the particular volunteer and they say they would like to visit their mobile the next time they come. And they're the ones that are seen in the community as the link. The fact that the nurses go out and they sit under a tree or they sit in somebody's house and the people are free to come to them and it's more like a family. I think that has helped the openness.
As the work of TASO and the mobile program in Kitovu Catholic Hospital continued, more programs began to develop. In Uganda district, a group of health workers at the district hospital established the Uganda District AIDS Care Organization, IDAC, in 1991. IDAC had two main aims: to make health care and social support available to people with HIV/AIDS, and to raise community awareness and understanding of AIDS. With training from TASO, IDAC has recruited and trained over 800 community AIDS workers. This success caused them to expand their focus and change their name to Integrated Development Activities and AIDS Concern. IDAC's achievements are best illustrated by the spirit of openness demonstrated by the people it has trained and served. When Florence Comunyo tested HIV positive, she received counseling and support from IDAC. Florence, a widow who now cares for her own children and those of her late co-wives, felt it was important to be open to her family and friends about her HIV status and give them as much information as possible.
When I went for counseling, they told me it was important to tell others about it. The problem I found in telling people about AIDS was that they didn't want to hear about it. They wanted me to keep quiet. But I saw it was important to tell my family because I wanted them to know what I was going through and understand that I didn't want to remarry and spread the disease. I also wanted my children to know about AIDS since they are growing and need to be aware that the disease exists and how it is transmitted. At first, when I told people, I got worried, thinking I had done the wrong thing. But now I'm very happy because people know what I am and don't talk about me.
Florence's openness has helped her children come to terms with her status and better understand the issues surrounding AIDS.
When my mother told us about her HIV status, I felt very sad. But what she has done has helped us. My friends now know a lot about HIV from the information we got from her. It's good that she has told us because it helps us protect ourselves.
Sulaiman Walia tested positive for HIV and was also cancelled by IDAC. Despite the encouragement to be open, Sulaiman could not tell his wife for fear she would leave him. Yet, when he finally did, her reaction was not what he expected.
When my husband opened up to me, I was happy because he had told me. I was sad, but somehow happy. I also tested positive, and we now protect against reinfection and have vowed not to spread the disease. When we both went public, people used to talk about us, but now they don't bother since we are the ones who told them.
Sulaiman's openness to his wife helped him to form a small support group, People with AIDS Development Association, PADA. PADA members come together to give one another mutual support and offer an example of positive living to other people. They also distribute condoms supplied by IDAC. Sulaiman now realizes the power of openness.
Opening
up to my wife helped a lot because now we can work together. PADA is meant to teach people, patients and non-patients about AIDS. My wife helps me in counseling women who would otherwise not approach me. Opening up the public is good. It seems to be the best weapon in the fight against AIDS.
In Uganda, traditional healers provide health services and advice on social and sexual problems to many people. In 1992, a small group of modern health practitioners realized that the influence the traditional healers had in the community was important and sought to involve them in the fight against AIDS. This would prove to be a difficult task.
It was quite frustrating at the beginning, because when we invited them together, every person putting up their hands to say something would say something negative, something really discouraging to us, and say, look, why all of a sudden are you inviting us to join you and work with you in fighting AIDS? Why didn't you recognize our role earlier before AIDS came? And it was like, shall we ever succeed in getting some real dialogue going? So a few of them realized that, mentioned in this meeting and said, look, AIDS is amidst us, it's in our families, it has taken our children, our own relatives. So let's put aside our traditional feuds and wars, and let's try to see what we can do together with these people from the hospitals. Yeah. So at least those positive voices did encourage us to go on. And eventually the negative voices became fewer and fewer.
That meeting and many others led to the establishment of traditional and modern health practitioners together against AIDS, THETA. THETA aimed at establishing mutual respect between traditional and modern health practitioners. They established a program to provide training for traditional healers in HIV/AIDS education, counseling and condom distribution, as well as setting up clinical studies on the effectiveness of some herbal treatments for common HIV-related conditions. Their efforts have met with great success.
Naye okusinziira ku ngeri gye natwalibwamu aba THETA ne bantendeka ku ngeri gye.
The way I was trained by THETA, I feel I was lucky. I have improved and now know what to tell my clients about protecting themselves from AIDS. We work with the doctors and refer some patients to them, and they also send patients to us.
Again, it was the openness about HIV/AIDS that allowed THETA to get off the ground.
If it hadn't been for the open stance that this country took at the beginning of this epidemic, we would have found it very difficult as doctors to go to traditional healers and work out a working relationship, because strictly speaking, this is against medical ethics. But because we saw HIV as a crisis, some rules had to be broken, certain things had to be done differently, and this was one of them.
By 1993, Uganda's open campaign against AIDS had seen many new initiatives develop, but none aimed directly at youth on a national scale. That same year, Straight Talk, a monthly newspaper aimed at giving teenagers information about HIV/AIDS, sexual and reproductive health, was launched. Talking straight about sex and sexuality can be controversial, but as the paper soon realized, breaking cultural taboos can be a welcomed relief.
Well, the challenges we sometimes faced was whether if we put something in print, it would be regarded as too straightforward or too open, because in this society people don't discuss sexual issues. But with the coming of AIDS, I think the Ugandan population had already been propelled forward to kind of being pushed from a region of where people don't discuss about sex, suddenly into an area where people had to discuss sex. And actually, I think the public was very tolerant of the language of the paper. Shocking as it was, you could say penis, you could write vagina without writing small animal, those words which people use. And nobody really said anything, because I remember parents at that time saying they did not want their 16-year-olds to be HIV positive. So everyone kind of braved it and read the words and said yes. Actually, one of the challenges we also faced was that parents school did not have experience discussing sexuality issues. So they were actually very happy to have this paper, which young people themselves can read and digest the information by themselves.
As the popularity of Straight Talk grew, the Straight Talk Foundation was established and has expanded the scope of its activities. They now publish Young Talk, another monthly paper aimed at youth aged 10 to 14, as well as local language versions of Straight Talk. In addition, there is the weekly Straight Talk radio show on 5 FM stations. And the foundation also runs a school visits program. It's a lot of work, and it seems to be paying off.
I like to read Straight Talk because it has lots of information, especially to me as a young girl, information about my body and how I should conduct myself in society. My favorite thing about Straight Talk is the column for letters, where people express their problems, then solutions are given to them. Actually, talking openness is very good, and it has helped me and lots of my other friends as young people. Because when someone is not open to you, tend to go to the ideas of your peers, which may not be good for you as a person. So Straight Talk being open, calling a spade, we learn lots of things, and we get to decide for ourselves.
For most Ugandans, their religious beliefs influence their sense of identity, their moral judgments and perceptions. Religious leaders therefore had to find ways to respond to the unique challenges posed by HIV/AIDS. In 1993, the Islamic Medical Association of Uganda implemented the Family AIDS Education and Prevention through Imams project and mobilized support in response to the HIV/AIDS epidemic. Sheikh Twaha Nsubuga underwent the training and now speaks openly about AIDS.
We have to fight AIDS through providing information to our people. We encourage couples preparing to marry to go for HIV testing. We talk to all married couples about staying faithful, being safe, and other sexual health matters.
The Christian Church has also played a major role in the fight against HIV/AIDS in Uganda. Many church programs have been established in response to the AIDS epidemic. In the area of openness, the response has also been very personal. In 1995, Reverend Gideon Byamugisha became the first priest in Africa to declare publicly that he was living with HIV. Although he was afraid to open up, Reverend Gideon felt he had no choice.
I decided to be open because as a Christian, I felt it very like being hypocritic for people to meet me and say, Reverend Gideon, how are you? And I will say I'm fine, when actually inside me I have what I could call the mother of all problems on earth now. And so I felt if someone said, how are you? I say, I'm not fine, I have this problem, I have AIDS, I'm going to die. You know, I wanted to be open, I want to be true to myself, that this is what has happened, this is what people should know. So it prompted me to be open.
At first, Reverend Gideon and his family suffered some stigmatization, but as his openness increased, so did the level of understanding and support he received. While he does not regret his decision, Reverend Gideon admits that openness does have a price.
Everyone is looking at what can people living with AIDS give us? What can they contribute to the fight? Very few people are saying, what do they need themselves? Support them physically, support them financially, support them emotionally and spiritually. So you find that you use your own resources and maybe at the expense of the family, at the expense of children. And I have seen that that's a very big challenge.
Despite the challenges of openness, Reverend Gideon has remained active in the fight against AIDS. When he told his bishop of his status, instead of being fired as expected, Reverend Gideon was asked to leave his teaching job at the seminary and head the HIV prevention and AIDS care project in his diocese. The project provides care and support to people infected and affected by HIV/AIDS in the hospitals and through post-test clubs. He sees this experience as an example for others to follow.
I think Namirembe Diocese has given a very good example of what churches can do to promote the fight against this problem and to reduce stigma. By, for example, allowing an HIV positive priest to remain active in the service. Not only even to remain active, but to work in the bishop's office is something which I feel really that many churches could emulate, support openly, you know, openly, not privately, but talk about it, you know, and so that people can know that actually, yes, if I revealed my status, I will not be at the risk of losing my job or losing the support. That's one. Number two, the churches can really promote the support groups. We've found that the post-test clubs can do a lot to reduce stigma in the rural areas. So if each diocese can run a post-test club, for example, in each archdeaconry or each parish, then you'll find that people's acceptance of people living with AIDS and their willingness to support them becomes greater.
Reverend Gideon's openness about his status demonstrated how personal testimony can be a powerful tool in the fight against HIV/AIDS. Others in Uganda have also taken up this challenge. The National Community of Women Living with HIV/AIDS, NACWOLA, was formed by and for HIV-positive women in Uganda. Its members get mutual support from one another through counseling and sharing experiences. Many NACWOLA members also feel it is their duty to speak publicly about living with HIV. As difficult as being publicly open is, NACWOLA soon discovered that its members had more trouble opening up at home.
One of the major challenges that we have experienced, particularly for women, is disclosure to your spouse, disclosure to your children, and maybe other members of the family. But the immediate family, that's a very difficult thing to handle. And from my experience, we realized that while most of our members, while most of us went out and told the world out there that here I am, I'm living with HIV, we were not telling our own children. And this is mainly because culturally, we do not talk about death, issues of death with children. We do not talk about issues of sex with children. And when you talk about AIDS, once you talk about AIDS, then you're opening the whole discussion around sex.
In 1996, NACWOLA started using the Memory Project as a way of helping its members open up to their children. The Memory Project helps parents compile important information and family histories that their children can hold on to forever.
We have 3 pillars in place that this project bases its strength. And the first one is to empower parents to disclose to their children, and this we do through training. We believe that it is better for a parent to tell her child that she has HIV than to leave the child to guess or to hear it from rumors or neighbors, than to wait for panic when you are dying. The second pillar of the project is we believe that parents should document important family history and information for their children, because most parents die when the children are very young, and from my experience, as the children grow, they lose values. The third pillar of the project is about making what we call secure plans for the future of the child. And this, we feel that for most of the time when we don't disclose, we waste a lot of time denying the problem than telling the children and beginning to work on secure plans for their future.
Actually, it's the Memory Project which helped me talk to my children about my HIV status. In the memory book, I would say there are moments, there are sad moments. But they also, I would say the book in itself, the children really like it. Because what I've really come up and if I also remember what I've been sharing with other women, they like to know about you. Where did you grow up from? Were you as a kid as them? And I think mostly maybe children have been seeing us as adults. So when you start telling them that you're also a child and this is what you liked and this is where you went to school to, and also explaining to them how they were born, who was there, how you chose their names. They really like it. Sad moments are in the book, but in actual sense, the children love the book. Now that I have opened up to my children, I feel less stress. Even I couldn't be sitting here in my house talking about my positive status.
Through openness, people living with HIV in Uganda have been better able to cope with the impact of HIV on their lives. Openness has also led to the success of condom promotion and voluntary counseling and testing. But the HIV epidemic still presents Uganda with many challenges. Openness about HIV/AIDS and towards people living with HIV does not yet exist in all sections of society or in all parts of the country. And fear of stigma still prevents many people from being tested for HIV or telling others about their HIV-positive status. Also, Uganda's very success has led to complacency and a drop in public and official involvement and support. The Uganda AIDS Commission, which coordinates the work of all sections of government and society in the fight against HIV/AIDS, is now redoubling its efforts to strengthen the national response to the epidemic. All government ministries are now required to do sector planning to integrate HIV/AIDS into their work.
The Commission with the development partners have embarked on various initiatives. The first one is to be able to develop capacity both at the center and in the districts to implement strategies to control the epidemic. Secondly, to mobilize all sectors, both government and non-government, to be able to have both strategic plans as well as annual activities directed at HIV/AIDS. Thirdly, we would like the communities to become what is known as AIDS competent, so that the communities are able to recognize the problem within themselves and be helped to develop plans that they can implement within the community. This initiative is known as the District Response Initiative. Finally, we think that in order to avoid complacency, we must tackle political advocacy and sensitization right from the president through cabinet, through parliament, at various levels in sectors, in society, up to the communities.
Taking an open approach to HIV/AIDS is not necessarily an easy option. Not for government officials, community and religious leaders, health workers, teachers, parents, or children. Yet in Uganda, many people have found the courage to be open and have not suffered for it. But openness is not only for those infected with HIV. We must all face up to the reality and challenges of the HIV epidemic. The silence surrounding HIV/AIDS must be broken. The time to make HIV/AIDS an open secret is now.
In fact, we need to increase the openness we have been having so that we do not only reach everybody, but we repeatedly reach everybody in a manner that will change his or her behavior.
By being open about ourselves, we are helping to stop the spread of AIDS. Since we are part of this organized group of people with HIV/AIDS, we can't start lying about our status.
If parents don't talk to their children about AIDS, they will face bigger problems in the future. I've told mine, and now they can grow up safe.
I think one of the things that AIDS is showing us is that it is saying, look, there are gaps in the way you live and how you relate to one another. And until you are open about those issues, you are not going to go anywhere. So openness, I think, is the key to defeating AIDS at all levels of society.
There's gotta be a ray of hope for this nation. It's only you and me, the young generation. So why don't we change, protect our lives in every situation? Let's join hands together, fight AIDS. There's gotta be a ray of hope for this nation. It's only you and me, the young generation. So why don't we change, protect our lives in every situation? Let's join hands together, fight AIDS. Ray of hope for this nation. It's only you and me, the young generation. So why don't we change, protect our lives in every situation? Let's join hands together, fight AIDS.